So I'm Roseanne Kenny. I'm a professor of medicine in Trinity College in Dublin, and I direct a syncope and falls unit at one of the major teaching hospitals in Dublin, St. James's Hospital. So the additional challenges for patients who have a history of falls and syncope are that the association between cardiovascular causes of falls is very frequently missed, and many of these are modifiable. So we recommend that if people are having unexplained falls, not clearly a slip or a trip, that they should be treated exactly the same as patients who have syncope. So my key advice to physicians who are looking after patients who have symptoms of falls and syncope is to have a high index of suspicion that falls may actually also be part of the same causes that are causing syncope. That's the first thing. To be aware that if the falls are unexplained, that will indicate likelihood of a syncopal event, or certainly shared cardiovascular causes for falls and syncope. Also, we recommend that one gets a witness account where possible. Now, very often in people who are having falls, particularly older patients, there is no witness account available. And if the patient themselves doesn't remember losing consciousness in a syncopal event, they present as a fall, hence the overlap between syncope and falls. But where possible, if the patient denies loss of consciousness, but you can ascertain a history from a witness who will acknowledge that there was loss of consciousness, then that gives much clearer instruction to the physician looking after the patient. So I've been with STARS for many, many years now as a patron with the organisation. And I first came across STARS probably 15 years ago when I was having difficulty justifying our very busy syncope and falls unit at Newcastle General Hospital, at the Royal Victoria Infirmary in Newcastle. And working with STARS as a patient advocacy group, we persuaded the then CEO of the hospital that it was worth studying and putting together a business case for the value for money and value for quality of care that such a dedicated unit provided. And of course now it's widely accepted that dedicated units are the way to go, that there's huge benefit in terms of the ability to deliver the guidelines in an appropriate environment. There's big cost savings in admission avoidance and also in avoidance of injurious events if these symptoms go undiagnosed. So my original encounter and collaboration with STARS led to great benefit in terms of developing the service, and I've continued my association since then, and I just find them a wonderful patient advocacy group, and certainly what they have contributed to our understanding of these symptoms and development of care pathways and access for patients with these symptoms is huge.